Good afternoon, everyone. Thank you for being here today for another edition of Fox News Healthcare. Today, we have a special interview with Haven Healthcare. As healthcare costs in the United States continue to rise, frustration is growing among employers who offer health benefits for their employees. In 2020, healthcare costs are expected to rise by 5%, and the growth in total cost of healthcare and the cost of premiums continue to outpace inflation and growth in wages. To make matters worse, despite this increase in spending, improvements in health outcomes are limited. Three CEOs of Fortune 500 companies, Jamie Dimon, Chairman and CEO of JP Morgan, Jeff Bezos, President and CEO of Amazon, and Warren Buffett, Chairman and CEO of Berkshire Hathaway, have united forces in order to completely redesign how healthcare is provided for their employees. They call the venture Haven Healthcare. We have them here with us today, as well as the person they have picked to lead this new organization, Dr. Atul Gawande. Dr. Gawande, let's start with you. Can you introduce who the players are in this collaboration, as well as what each brings to the table?
Yeah, thanks, Tucker. As you mentioned, Haven brings together three companies, number 4, number 5, and number 18 on the 2019 Fortune 500. Together, these three companies employ 1.2 million workers and have a combined revenue of over $677 billion. Their large employee and resource pool, as well as their success and respect in the US economy, gives them a unique position to develop innovative approaches to curbing their company's spending on healthcare. All three companies are successful because they've broken barriers in their industries, and they plan to use that mindset to do the same with the healthcare industry.
So, Mr. Dimon, can you tell me what the ultimate goals of this venture are? What does this organization hope to accomplish?
Yeah, so Warren, Jeff, and I were sitting around in DC completely bemoaning the healthcare system and discussing how ballooning costs of healthcare act really as a hungry tapeworm on the American economy. So that's when we decided to establish a venture to provide a platform that addresses the healthcare costs and outcomes for our employees. Essentially, we're trying to find ways to crack healthcare system problems in little ways. Telemedicine, a drug, chronic care, better design of insurance package. We want to do it for our people, and if we can, help America in some way. We're really seeking to create solutions that provide simple, high quality, and transparent care.
Okay, thank you for that. So take me through some of the timeline from this sit down to where we are now and what's going on with the organization.
Yeah, so we formally announced our collaboration in January 2018. 6 months later, hired Dr. Gawande to lead the joint venture, and we also established our headquarters in Boston. The following year in 2019, we announced the joint venture's name, Haven Healthcare, and also opened our second location in New York to support our tech and engineering teams. Right before this meeting, before the end of 2019, we announced partnerships with innovative insurance companies, Cigna and CVS Health/Aetna, to offer health plans to thousands of our employees and to gain insights on the best way to manage care in certain areas of the country.
Okay. Well, Mr. Hathaway, can you explain to me if this is a unique collaboration? Have there been similar collaborations in the industry? Have they been successful? What are your thoughts?
Yeah, thanks, Tucker. So this collaboration is actually the first of its kind. We truly believe it is possible to deliver simplified, high quality, and transparent healthcare at a reasonable cost. We're focused on leveraging the power of data and technology to drive better incentives, a better patient experience, and a better system overall. Our work may take many forms and solutions may take time to develop, but Haven is invested in making healthcare much better for all of us, and we hope to pave the way for other health systems, payers, and providers in pursuit of achieving better healthcare. We are outside of the healthcare industry and have a certain advantage of being outside of the problem and looking at it in a different way. A lot of self-insured employers work with health systems, but we want something different and want to work with payers and providers directly to obtain better care for lower costs. We're going to be spending this year doing tests through partnerships with other companies, which could potentially lead to lucrative deals for those who deliver. The challenge will be figuring out what we need to focus on.
Okay, thank you for going through that with me. Mr. Bezos, given that it has taken some time for the organization to get off the ground, describe if this collaboration has been successful? And if it's too early to tell, what are your thoughts on future success?
Yeah, so our mission is to transform healthcare to create better outcomes and overall experience. We've been really transparent about the fact that this process takes time since our announcement in January 2018. So our success is still to be determined as we develop the innovative and game-changing solutions we're working towards. Since we are pulling from the resources, business knowledge, and employee base of Amazon, Berkshire Hathaway, and JP Morgan Chase, we have strong potential to create a successful and revolutionary health plan for our employee pool. The access we have to not only our resources, but also the revenue from our companies allows us to focus solely on health outcomes without concern for a bottom line. We are free from profit-making incentives and plan to reinvest any surplus back into our efforts to improve healthcare. With this direct focus purely on health outcomes in our employees will naturally improve, creating a sustainable model in the long term. In order to revolutionize US healthcare, though, more health plans in the US would need access to these types of resources and employee pools. So our healthcare model may not be able to translate across the country.
Okay, thank you for that detailed explanation. Dr. Gawande, let's wrap around back to you since you are closer to the implementation side and really trying to get it off the ground. What are some of the factors that you're considering in this collaboration?
Yeah, so as Warren mentioned, this collaboration is the first of its kind. The first element that I'm considering throughout all of the steps is really trying to align the priorities of the three organizations that formed Haven. So while Haven has a defined mission, it's important to note that each of the three companies may have a different idea of what success looks like and how to get there, especially considering that the three different companies have different employee bases, they're located in different parts of the country, and other factors that may make their goals and their successes different. Another thing that I consider throughout all steps of any implementation is that we are changing the healthcare industry. We're seeking to take power away from other players, whether it's private insurers, pharmaceutical companies, providers, and giving it back to employees and patients to have more control over their spending. This may have radical effects on society in terms of its impact on patients, as well as its impact on the entire industry. Patients, while they may be unsatisfied, have become accustomed to our current system and may be fearful of resistant to change. This collaboration will test the status quo of our current system.
Okay, let's finish up with one question that I have specifically for you, Dr. Gawande. It's clear that you have the utmost confidence from these highly successful CEOs. Why were you selected? Why Dr. Gawande for this role?
Yeah, I ask myself that every day, but I think it's because I'm not quiet when it comes to my dissatisfaction with America's healthcare system. My unique perspective as a clinician has given me a firsthand look at the shortcomings of our current system and how it affects patients and their loved ones. I've spent a career observing these flaws and pointing them out, and now I'm honored to have the opportunity to actually do something about it.
Okay, well, I'd like to thank you all again for being here today for our special edition on Haven Healthcare. Coming up next, Clorox or Lysol, which one will help you beat coronavirus?